Let's chat and find out what is the state of hospitals and healthcare sector at large now. Are hospitals running out of beds? How will hospital manage the rising cases in India that we are seeing for COVID-19? And will Unlock 1.0 really lead to other services resuming? Because for the last 3 months, it's really been all about COVID-19. And who better than Abhay Soi, the chairman at Max Healthcare, joining on the show to answer all these questions that we have. Abhay, hi. Good morning. Hope you're doing well, and everyone at Max as well. Just wanted to understand, Abhay, what really is the situation? Because, there is so much news flow and so much misinformation as well, which is spreading out there. We really don't know whether hospitals at large are equipped to take care of the rising corona cases.
Look, I think it depends rising to what extent. And as you've seen, even in a lot more developed economies with much more robust healthcare systems, they have been inadequate. So far, I think we've been doing quite well, especially because of the lockdown. People have had an opportunity to prepare their supply chains, get ready for this. And so far, we've been doing well. But the jury's out. What's going to happen going into the future? What we saw initially due to the lockdown was also a lot of the normal work, the elective surgeries and so on and so forth, and even the serious surgeries actually went down, and which led to occupancy levels coming down to about 25 to 30%. But what we've now seen is those have started surging back as well, besides the corona and competing for bed space with corona. Now, what happens is, at least in the private sector, the hospitals are integrated. These are meant for large-scale coronary care, transplants, oncology surgeries, and so on and so forth. Not necessarily meant for infectious diseases, because in order to take care of infectious diseases, you need isolated spaces, while these hospitals have integrated spaces. So we are at present doing about 600 beds across the country of COVID, which is perhaps the maximum amount anybody in the private sector is doing. But what we are seeing is, look, this virus, while is spreading very fast, the virility seems to be very low. I can tell you, we've had across the board about 350 to 375 people, our employees who got infected, but none of them have been serious. I mean, that's a big number, but none of them have been serious, let alone any fatalities. But what we are seeing is a lot of this is many people will perhaps get infected, but it's not going to be very serious for a lot of people. So essentially, I think as we go along, I think we perhaps have to learn to live with this.
Yeah, good to hear that, that while a lot of people are getting infected, the fatalities as a ratio is pretty low even at this juncture. But tell me, Abhay, you talked about the surgeries or medical cases beyond corona. Have patients already begun to trickle in now that we are in Unlock 1.0 and not amidst the lockdown?
Absolutely. So what we've seen is even serious surgeries like cancer, stage 2, stage 3 surgeries had been postponed. A lot of that has started coming back. Even when we say electives, really what is elective? These could be knee replacements, and these are urology surgeries, gastro surgeries, and so on and so forth. Perhaps a knee replacement can be set aside for some time. You can maybe manage with the pain. But, some of the other surgeries, how long is it that you can push them by? Going to a hospital is grudge by in any case. I mean, nobody's doing it out of choice, really. I think you're doing it out of compulsion. And frankly, you can push it by a couple of months, but, it's going to start coming back. And this is what we are seeing. We are seeing capacity utilization move up.
Abhay, what if we see a further surge in cases? India is already on track to become, I think, one of the top 4 in terms of numbers of cases. As you said, it's great to see that people are recovering. But in terms of managing the kind of numbers that are being talked about over the next 1 month or so, and even if we see a resurgence down the line, are we adequately prepared? Do you see spending on healthcare actually going up in light of this?
So look, I think in the short run, we see a lot of state governments, Delhi, Maharashtra, I can tell you, and many more. They're doing a lot to make makeshift hospitals, create hospitals, and so on and so forth. I think this was what was done in the United States, was done in the UK as well. So I think that is the route. These are going to be temporary makeshift hospitals. But having said that, I think in the long run, the whole world, India, governments across the world have taken, I think, serious note of this situation, and who hasn't really. And what you're going to see is that perhaps a lot more investment of GDP units, or less than 2% in India, going towards creation of infrastructure and so on and so forth. I think other than that, you also see a lot of investment by individuals into insurance. They'll be purchasing insurance because now, I think people have woken up to the seriousness and perhaps the necessity of having a robust healthcare system. I think it's a matter of national security, if you ask me.
Absolutely, and I agree. I hope we do see more emphasis on that going forward. Do you also expect, spends really to also come in globally? Give us a sense of how you see the dynamics playing out post-COVID, the kind of implications perhaps this is going to have on the sector.
So I think, what you're going to have. Firstly, prevention is the best form of cure. So, what you're going to have is perhaps disaster management systems, particularly to do with pandemics and healthcare systems, put in place and to be activated when such situations happen. You've seen that in the East, where they had the SARS epidemic, and they've been able to handle these things much better because they've had disaster management protocols in place. I think whether at a national level or at a state level, that needs to be put in place and activated as and when these situations happen. So I have no doubt that we will be, whether globally or domestically, much better prepared for this new unknown enemy than perhaps we ever have been in the past. But, so that's one part of things. And I think, the investment towards diseases, to infectious disease, infrastructure which supports infectious diseases is going to move up. There's going to be a lot more investment, I believe, in the pharma industry towards vaccines and so on and so forth to take care of it. So I think, the whole world has woken up, taken notice, seen what damage it can do to global economies, let alone. And, it's a very, very small, a stitch in time can really save 9 in this situation, can't it?
What is happening to your business? In this environment, have footfalls gone down? Have routine surgeries and routine procedures taken a backstage seat? Because a lot of private hospitals have committed to COVID care. But ultimately, hospitals and some big hospitals in India are listed. So if I have to understand what this COVID crisis means from a standpoint of shareholder, is there a business disruption?
There's obviously, first and foremost, I think we are fortunate to have any business. I think most industries just come to a sudden halt, whereas perhaps the healthcare hospital chains haven't. We've had some business, although like most places in the world or most sectors, we've all been hit. Our main business has been hit. Having said that, we've had a peculiar problem because we had to, at one end, most people have addressed this issue by mothballing their businesses, while we've had to ramp up our operations to meet higher demand for COVID. This at a time while our main and our core business has been going down. So we had our challenges, and we had to operate during lockdown, where supply chain and so on and so forth have been a huge issue. And we had to address that. We had to support our patients, our people through this very trying time. 700 of our people have been quarantined. Many people had to be moved between states, between UP, Haryana and Delhi and so on, because the borders were shut. So doing that in the Tri-City while operating hospital has been very challenging, no question about it. I think having said that, what we saw is occupancy levels go down to about 25% across the board, and it's out in the public domain that most hospitals did take a hit. And that's largely because of the lockdown. But what we've seen is since the lockdown eased up, so have people started coming back to hospitals and so on. And, we've seen a ramp up of capacity. The good part from the industry standpoint is that we've had a ramp up of capacity of occupancy. But I think the bad part from overall this thing is these people will also be competing against COVID beds which are available. So look, I think there are going to be some challenging times ahead. Will the business go back to absolutely the way perhaps we left off in February? Maybe not. Maybe normalize through the year, and we'll pick up perhaps towards the Q4. But at present, we are doing well, but not as well as one should be doing.
So what happens next? Would you be looking at stalling your expansion? Would you be looking at reducing your bed capacity? How will you conserve cash and ensure that the COVID disruption does not hit your balance sheet and your financials?
So I think, during this phase, of course, we'll postpone any expansion plans and we'll pick up when things normalize. There's no point expanding further capacity at this point in time. Having said that, we were already operating at about 75%, 76% occupancy with most of our flagship hospitals and the mainstays at 80% plus. I will definitely not be bringing down capacity at this point in time. I'm fairly certain by Q2, Q3, we should be back to where we left off in terms of occupancy and utilization. Perhaps, medical tourism and stuff like that will take some more time and come back in Q4. By the end of the day, it is the healthcare sector, it's the hospital sector. I do expect it to bounce back sooner than perhaps other sectors will.
What has been your experience dealing with state governments? The Mumbai story or the Maharashtra story is very different from what I hear in Delhi. Similarly, what's happening in Tamil Nadu is very different than what the government of Telangana and Karnataka are doing. What's been your experience dealing with state government? Do you think something needs to be done there? Would you like to share experiences?
So look, it's not one size fit all. If you see Mumbai, Maharashtra story, Maharashtra is perhaps a couple of weeks ahead of Delhi in terms of, and ahead of most other cities in terms of the surge of the virus. That's one. Secondly, if you actually see the sort of infrastructure which is available, healthcare infrastructure in the NCR region and maybe even Chennai is a lot more robust than in Maharashtra and Mumbai, because look, real corporatization of hospital hasn't really happened over there. Far and few corporate hospitals which have, and private sector really hasn't entered in a major way in that place. Thirdly, also because there is a shortage of space. Most infrastructure, healthcare infrastructure, is very compact and integrated. So you can't really necessarily segregate COVID and non-COVID over there. So that becomes a larger challenge in Mumbai. All of these situations creates a different test for the state government, and the way they tackle it is different. So, you can't really compare how Delhi's tackling it, how Maharashtra's tackling it, and, I honestly don't have much idea how Tamil Nadu is tackling it. Delhi, if you look at it, it's been planned well. The private sector is working collaboratively and very well with the government. We have 130 beds, half of our hospital in Mumbai, which is doing COVID, but we have a standalone hospital in Delhi. Plus, we've done more capacity, and we'll be adding some hotel beds as well, because we've been directed by the Delhi government to take on some hotels, which will be created, which will be converted into hospitals. So, the ramp up in Delhi is different, and my experience, frankly, has been pretty good working with both the Maharashtra state government as well as the Delhi state government.
Well, I appreciate your time. Thank you for all the good work hospital like yours are doing. First, protecting and ensuring that there is safety of the entire society per se. I mean, all of us cannot thank enough the role doctors, hospitals, and tertiary care providers have really provided.